Well, I think it's important that the person decide for themselves to go into recovery, because basically they're the ones that has to make the changes, be dedicated to recovery and to taking the steps in order to achieve their goals.
I looked around me and saw the people that I used with were dying or ending up going to prison, and I just didn't want that life anymore.
It's not something that will just happen. It's not something that's going to be easy.
You gotta feel it inside you. You gotta want to do better for yourself, and that's the only way you can recover.
You can go in lots of different directions. There's lots of help. There's lots of concerned people. Our communities are full of people who care and want to see people get the help they need.
Calling the Drug and Alcohol Commission is always the first step that I tell everybody. That way they can get them into a outpatient or an inpatient rehab.
They can get a hold of our office and we can set people up with any level of care.
There's 2 levels of care in outpatient. The outpatient, 1 time a week, say, that's the living in balance model we use, and then intensive outpatient can be anywhere from 3 to 5 hours a week.
You will get set up with a counselor. The counselors make a treatment plan for each person that they see.
The person can go meet with their therapist, be there an hour, hour and a half, or a group session where they can talk amongst themselves with a therapist.
They will do activities and a lot of talk therapy to work on those specific goals for that particular person.
So we're using material that is researched and found to be effective when dealing with addicts.
Outpatient, you're going to a program where you go in, you meet with a therapist one-to-one, you're in a group setting, and then you leave an hour or so later.
You go to the facility, you actually stay there morning, noon, and night.
The inpatient it's all inclusive. You got your therapists are there, you are having your meals, your groups, your doctors, all in one place.
There's individual sessions where the individual will work alone with their counselor. There's a lot of group therapy sessions.
I've seen lots of folks recover, through the more traditional means of medical help, treatment facilities, counseling through professional agencies. But more than anything else, I've seen what seems to work the best for most are the 12-step programs.
The statistics and research shows that those people most successful in recovery uses 12-step programs as a platform.
My mom's process to get clean and sober. She started to go to meetings, and she would go every day. Every night she went to a meeting for a very, very, very long time.
They all come together on an equal basis and talk about their situation in life and talk about their experiences with the addiction. And from that, people learn.
You're hearing from people who were where you are at one point, and now they've managed to gain control back of their lives, and they give you something to try to work for, or somebody to emulate.
I guess the process was just getting her to go and her talking to people about everything that she was going through, and it definitely improved everything about our life.
I went to AA meetings, to NA meetings. I went to treatment on an outpatient basis, took advantage of case management services, got involved and active in my church.
This is something you can complement what you've learned at the rehab and through the counseling process, outpatient, inpatient, whatever. We encourage all these things to come together.
So you need that support system. It's hard to do anything with recovery on your own. You need supporting family, you need supporting friends.
It's very important to have a support system. It's a tough thing to overcome on your own. So a support system will be there to help you on days you're struggling.
Natural supports like through their families, and And then there's self-help groups that they can access for support. There's the Certified Recovery Specialist program, which offers that peer-to-peer, someone who has gone through recovery, who's been trained.
And I took Encounter, I moved from the city I was in, moved back to my hometown. I do not talk to any person that I used, drank, anything. I do not talk to any of them.
Each day is a new day, and the recovery is possible. It happens every day. That if somebody like me could recover and live a normal, successful, happy life, that really anybody can.
Once it's accomplished, you see people who become, again, who they were meant to be, and families heal and relationships heal.
Once she got sober, a few years into it, our relationship really grew a lot. I felt comfortable sharing things with her.
They will begin to, feel good about themselves again, to gain the self-esteem that they lost.
I feel more confidence in doing a lot more things in myself. I feel more, I can accomplish a lot more. I feel like I can conquer the world.